It's possible that taking very good care of your health is very important to someone who has diabetes. This could mean carefully reading food labels while you shop, setting alarms to remind you to take your diabetes medicines, or even thinking about taking supplements to improve your health. These actions are good and are often suggested. However, it's very important to talk to your doctor before adding any vitamins to your routine. This is because some vitamins may affect your blood sugar levels and make your diabetes medicines less effective. When treating diabetes, it's important to know about possible drug supplement interactions. We will talk about 2 vitamins that people with diabetes should not take in this video. Let's discuss food versus vitamins, which absorb nutrients and spot deficiencies. There are a lot of people who think that taking a pill is the same as eating whole foods. That being said, the body absorbs nutrients better when they come from food. Think about this. Whole foods contain vitamins, enzymes, fiber, and other things that help the body absorb and use nutrients. Because of this, eating a varied diet is much better for you than taking a multivitamin. It's still not clear if taking vitamins and minerals as pills works the same way. However, supplements might help if you really do need more of a certain vitamin. People in the United States most often don't get enough vitamin D, vitamin B12, calcium, or iron. Blood tests are the only true way to find out if someone has a deficiency, but some symptoms can help. Before taking any vitamins or minerals on your own, you should talk to your doctor if you think you might be deficient, and that a vitamin might help. Number 2, niacin. Niacin, also known as vitamin B3, is found in foods like beef and chicken, and is sometimes taken as a supplement to lower cholesterol. However, people with diabetes may be at risk because it may cause their blood sugar levels to rise. Studies show that niacin makes insulin less effective, which makes managing diabetes harder and may even raise the risk of getting diabetes. People who take niacin should keep a close eye on their blood sugar and talk to their doctors because it may affect how their diabetes medicines work and require changes. Even though niacin raises HDL, the good cholesterol, there isn't strong evidence that it lowers the chance of heart disease. Number 1, vitamin E. As an antioxidant, vitamin E helps keep cells from getting hurt by getting rid of dangerous free radicals. People with diabetes may benefit from antioxidants because their high blood sugar makes more free radicals. But the American Diabetes Association, ADA, says that diabetics shouldn't take vitamin E pills on a regular basis. Some people may need to take extra vitamin E, like those who are taking Orlistat, a drug that makes it harder for the body to absorb vitamin E. Daily doses of up to 400 IU of vitamin E are thought to be safe. However, higher doses over 800 IU may raise the chance of bleeding, especially in people who take blood thinners like aspirin or warfarin. Alternative vitamins and supplements that diabetics must have. People with diabetes might not need to take supplements if they are getting all the nutrients they need. But people with diabetes can run out of nutrients because of things like their medications, the quality of their food, their health, and the way they live their lives. These are some important nutrients that might be good for you. Number 4. The B vitamins are B6, B9, and B12. These vitamins help keep homocysteine levels in check. Heart disease is linked to high homocysteine levels. Metformin and other medicines can make it harder for the body to absorb B9 and B12, which can raise homocysteine levels. A lack of vitamin B6 can happen because of getting older, having liver disease, or taking certain medicines. People with diabetes who are taking metformin should be closely watched and, if necessary, given extra help. Number 3. Vitamin D. Vitamin D is important for your immune system, bones, and happiness, and not getting enough of it is linked to type 2 diabetes and insulin resistance. Even though taking supplements hasn't been shown to lower the risk of type 2 diabetes or lower blood sugar levels in people who are pre-diabetic, the American Diabetes Association, ADA, says it may help people who are deficient. Number 2, calcium and magnesium. A lack of magnesium in diabetics can cause high blood pressure and trouble controlling glucose and lipids. Magnesium is needed for more than 300 enzyme processes. People who are at risk should be checked regularly and take supplements. Magnesium citrate may work better than other forms, but the daily dose should not be more than 350 mg to avoid side effects like diarrhea. Number 1. Alpha-lipoic acid, or ALA. ALA is an omega-3 fatty acid that the body can't make on its own. It has to come from food. Neuropathy and macular edema have been helped by it in the past. People with diabetes who have problems with their eyes should talk to their doctor about taking ALA supplements. Tips for healthy eating if you have diabetes. Consider simple, long-term diets before buying supplements, which may be ineffective or risky. Whole foods provide critical nutrients. Eat more plant-based foods like fruits, vegetables, whole grains, nuts, and seeds for fiber, vitamins, minerals, antioxidants, and healthy fats. Slowing digestion with fiber helps regulate blood sugar. You may easily increase your fiber intake by adding a fruit or vegetable to every meal, choosing whole grains for at least half your grain intake, and eating unsalted nuts daily. The 2020-2025 Dietary Guidelines for Americans recommend 25 to 38 grams of fiber daily. Start with high-fiber foods slowly and drink plenty of fluids to avoid bloating. Mix carbohydrate-rich meals like grains, potatoes, beans, and corn with non-starchy veggies, lean meats, and healthy fats for satiety and nutrients. The plate strategy works. Half your plate with non-starchy vegetables, a quarter with lean protein, and a quarter with complex carbs. Roasted chicken, stir-fried broccoli, and baked sweet potatoes are healthy and delightful. Taking care of diabetes is more than just keeping an eye on blood sugar levels. It takes a whole-life approach, especially when it comes to diet and supplements. Supplements like niacin and vitamin E can be good for your health in some ways, but they can also make it harder to control your diabetes in other ways. It's important to know what taking these vitamins means and to talk to your doctor before making any changes to your routine. Eating a lot of whole foods, fiber, and well-balanced nutrients can also have a big positive effect on your health, making you less likely to need vitamins. Care should be taken to treat nutrient deficiencies with a choice of natural food sources and a cautious approach to supplements. Remember that everyone has different needs, especially when dealing with a disease like diabetes. Don't forget to share, subscribe, and leave a comment to get more interesting information like this sent to you. If you are diabetic and want to know if coconut water is good for you. Our previous video was on this topic. The link to the video is in the description. Click and watch the video to clear up your confusion.